Okay, for those of you that are here right now, we'll wait a couple minutes. I said for everybody to please log back in at 10:10. Um, your mics are on mute, so I know you all cannot talk to me. I've had to lock in all sorts of different things. Salam, I see your hand raised. I'm going to ask that you please move down the hand. Okay. And what I need is I need somebody, actually, okay, I see 108, 124, perfect. We're loading back in. Okay, I see students coming back in, perfect. We have got this being recorded. So I'm going to give everybody a minute or two to log back in. There is definitely something up with the channel. Oh, we're getting there. Lovely. More people are logging in. Guys, if you'll please put your hands down. Okay. For those of you that have hands up, please put hands down. Okay. We have almost 200 of you back. Now, the only thing I'd like you to do is while we're waiting for everybody to log back in, is what I would like you to do is please just, if you can, since you do not have mics right now, which is from my side, if you would raise your hand, everybody please raise your hand. Can you see the picture of the health policy screen? And can you hear me clearly? Okay. I am going blind on this. I'm going to go ahead and start class. We are 15 minutes behind. Oh, Abdullah, thank you. I now see, oh, lovely. I see the hands coming in. Thank you. Okay. So, thank you all for letting me know that. Perfect. Now, what we're going to do is we're going to go ahead, and I apologize with not having the mics on. We're definitely going to have to work on some technical issues before class on Monday. You know, in the office hours, we could talk and everybody could talk back and forth, and it was very easy. This morning, I want to take some time. I know many of you were very upset by your classmates who caused us huge heartache on Monday. And I know that many of you, and especially those of you that I had for the first week, since I'd had you all before, are really interested and involved. I am not going to take, while I asked you all to read this PowerPoint on your own, I'm not going to take the whole class to read every definition. What I am going to do quickly is I'm going to take a few minutes. I'm going to go through some of just the basics of what I thought were important concepts. We will then have questions. Hopefully, I'll figure that out later. Okay, with office hours, you definitely have questions, but we'll figure out how to have an interaction and a discussion live as well. So, the lecture that we were going to talk about on Monday, I was going to give you some definitions. And it's really about things about what is health, what is disease, things along those lines. I gave you here a couple of different definitions of health. And the WHO definition of health includes not only your physical well-being, but your mental and your social well-being. We have other models that include financial, that include what we call spiritual well-being. we have different components. I often say to students who are first starting in a health class, have you ever felt really bad one day and you just felt bad, like blue, sad, angry, and as a result, it was really hard to get out of bed? Most of us would tell you, yes, yes, you felt like that before. That shows you very clearly that kind of, oops, I'm sorry, I took the screen away. That's really trying to show you the association between mental health and physical health. We know, and I have lots of studies that show us if we have what we call perceived social support, friends and family we can rely on and turn to when we're sick or when we need things, we tend to be healthier. Down here, this health is I like this because let's think about we've been genetic environmental conditions. It's talking about being able to change. So if you look at this slide, it talks about health being on a spectrum. Most of us are not perfectly healthy specimens, and most of us are not, actually, all of you are not dead yet, okay? We're somewhere on a continuum. And at different times, we have better health, and sometimes we get sick and we need more, and we follow down towards the red line. So we move back and forth on this continuum. Now, with diseases, there are definitely definitions, and we can talk about two different types of diseases. And actually, we're going to spend the semester probably talking about two specific ones. We're going to talk a whole lot more about COVID because we're living through it. COVID is a communicable disease, which means what? We can spread it from person to person. It may spread from animal to person. It may spread from food to people. It can spread different things. We know that COVID is respiratory, but here are other examples. So these are things that we spread from person to person, from person. We also have, and typically what I spend most of my time often talking about are non-communicable diseases, okay? When we look at non-communicable diseases, we're really looking at things like heart disease. Up here, you'll see the little heart and lungs, which comes from smoking, respiratory disorders, diabetes, cancer, okay? Depression, and I've got depression written down here. These are diseases that we say are related to lifestyle factors. In other words, lung cancer is very highly related to people that smoke. Heart disease is related to lack of physical activity, diet, gosh, all sorts of things, okay? Genetics do play a part, but I can't give you heart disease. I can't give you diabetes technically as a person. I could make you more genetic risk if I'm your parent, but I can't give it to you, okay? So we look at have a different way of treating it because it's an impact on the individual, not the community. Communicable diseases affect a community. So we treat them differently. And I really wanted to make sure you kind of understood the difference between a sign and a symptom. Okay? And so I know you can't answer me verbally right now, but I want you to think if we talk about a sign is what? Something we can observe. They show here he can measure your heart rate. You can watch me when I'm talking. If I wasn't talking as much, you can watch my chest go up and down. And typically, when we're doing respirations on a patient, okay, when we're doing our vital signs, we're getting their pulse, we're taking their temperature, we will actually be talking to them and watching their chest rise and fall. And we do this to try to get what is their real respiration rate, because if we just look at your chest, Okay? What are you going to do? Or you're afraid you're breathing too slow, so you slow down. We want to catch it at natural. So it's a sign. Um, if I have somebody that has maybe congestive heart failure, a sign could be that they have swollen ankles, what we call edema. Okay? If we're looking at COVID, if you think about this, a sign of COVID, they're tired. We see them not being able to walk, being very lethargic. They may have a temperature. What else? We see that they can't breathe. Okay? So those are signs. Symptoms are how they feel. So somebody with COVID may say, I'm really tired. Um, I feel like somebody's sitting on my chest. They're not telling you, we're not measuring something, but they're telling you how it feels. Um, I feel nauseous, as they say down here. A symptom is something we feel, okay? So it's something internal. And what I want you to do is over the next couple of days, just on your own, is look at some things and say, is it a sign or is it a symptom? Because I can promise you, you will see a difference between knowing what is a sign and a symptom on the first exam. Now, the next little set of slides that we were going to talk about on Monday were definitions, and we have a couple of definitions. One is community medicine, one is public health, and one is global health, okay? Community is just that. A community could be your home and your family, okay? We're talking about the health of an individual within a certain environment. So we're talking about a neighborhood. It's much smaller. Community health, we may be talking about health centers. In Amman, there are probably 90 or 100 different community health centers designed to be close to deal with that little pocket of what that area needs. And with community health, it's things like being able to give you vaccinations, being able to give you quick antibiotics in case somebody has a sore throat, things along those lines. It's not designed for trauma care, and it's not designed for high, but it's designed as prevention. Vaccines are prevention, giving you materials about diet. If a woman is pregnant, prenatal vitamins, having prenatal checkups, that would be something we would do in a community medicine type of. Now, public health. And I love this diagram down here, this image. If you look at this, and you can blow it up on your own from the other slides, it talks about public health being a component of lots of different things. Okay? It's about health promotion, which is me talking about eating 5 fruits and vegetables a day. Me talking about wearing your mask right now. Me talking about awareness of if you just exercise 10 to 15 minutes a day, and we're not talking stringent, we're just talking a nice walk, you reduce the risk of a heart attack tremendously. That's health promotion. So it's little easy snippets that we send out to all the public. Okay, we've got research, which means we're always reading and studying and figuring out what are the relationships between different variables. We're talking about prevention, hand washing, biggest prevention for every type of disease. Okay, we're talking about your risk. Are you overweight? Are you a smoker? Different variables that can contribute. We're talking about communication, sharing those with the public. You notice that while I can't do the Arabic, I read every day the little snippet on Jordan. I find more about Jordan, though, in the New York Times, as they keep the numbers, than I do actually from an English paper here in Jordan. Okay, we're talking about epidemics. Someone this morning in office hours asked a great question about what is. Gizzy, it's okay. Thank you. Thank you, Gizmo. Okay, they asked the question, what's the difference between a pandemic and an epidemic? Gizzy, quiet, please. And you wonder how we have a quiet dog all the time. A pandemic, pan is the prefix, and it means global or world. So what we're talking about, an epidemic is an outbreak or spread of a disease in a certain community. When it becomes a pandemic, it means it's affecting the whole world. Okay, monitoring. All these numbers I've been showing you, that's monitoring. How many people have the disease? How many people have been hospitalized for the disease? How many people are sick? Is it stop? Stop. Here. Now, so that would be that component. Analysis. When you get further on, we'll talk about doing different types of statistics that we could use. Case fatality, some of the mortality rates, incidence, prevalence are examples of different types of analysis. So we look at public health, and it's about preventing disease, prolonging life, and promoting health through various organizations. How is this different from global health? Public health really is dealing with, I want to set the policies in Jordan. Global health means, again, we've gone back to the world perspective. We will spend the last lecture, Unit 8, is on what we call SDGs. SDGs stand for Sustainable Development Goals. These Sustainable Development Goals are global health, okay? It is the 30 some odd criteria that the World Health Organization has set that says, how do we deal with this? Number one of those is poverty. Number two is proper nutrition and reduction of starvation. Number three is education. So we're dealing with very different things, but we know if we get society at a certain level where children aren't starving, where people have a roof over their head and they're safe and they have a job and they can afford meals and safety and provide for their families, then we can deal with other health issues. So a lot of global health talks about building the balance. So then we can, from that point, we can deal with health issues. Okay? When we talk about global health, demographics, and we're going to talk specifically about demographics on Monday. We're talking about economics. What are the financial costs? If we do this, can we afford this over that? Epidemiology, we're already doing. Those are the statistics that we study with health-related diseases. What are the politics? Do you have somebody crazy like Donald Trump who's telling everybody, don't worry about the disease? He tells two things. Don't worry about it. We're turning a corner. The second thing he tells everybody is it will go away. Those are not lies. The problem is it will go away when? We will turn a corner towards what? Right now we're turning in the US and in Europe and other places, we're turning a corner not towards positive, but towards negative. Okay, it's getting worse, not better. We are turning a corner. It's not the corner we want to turn. Eventually, diseases do go away. Some are seasonal. What we know about COVID right now is it's not seasonal. It's stayed with us since March. We've gone from spring to summer, and now we're going into fall. And it didn't go away. If it was seasonal, it would have gone away already and started repeat. So we look at all of these different components when we talk about global health. These are just some stats. I do think it's important that you know that nearly 10 million people every year die from preventable diseases. That's not just NCDs, that is all preventable diseases. Many of tuberculosis, malaria, we can prevent some of these, okay, even though they're communicable diseases. That's important. The other, just kind of to give you priority. If we look down here, about 1 out of 8 people around the world will never see a healthcare professional. Okay? So what are the 3 key components from global health then? Worldwide improvement of health. Notice that reducing disparities, which I've already talked about. That's getting everybody to have food and shelter and safety and those things. And then the third thing is to protect against global threats. What do we know about COVID? Viruses and bacteria? Okay, you and I need a passport to travel in or out of Jordan. Does a virus need a passport? Does a bacteria need a passport? No. So we have this continual issue, okay? So they don't know borders. So when we talk about community spreads and things that are communicable, it's not going to stop at a geographic line and go, oh, can't go there. Okay, so we have to talk about how do we work together. These are just pictures of examples of different organizations that deal with health issues around the world. Okay, you don't have to memorize all of them. What I want you to realize is there are hundreds, if not thousands, of different private companies that work in this. Probably some of the most important are things like the WHO, UNICEF, the World Food Program, which just won a Nobel Prize this year, about a week ago, the United Nations, the World Bank. Notice down here they talk about the Sustainable Development Goals. Okay? What you do need to know is we have a term for a lot of these organizations. NGOs, non-governmental organizations. What does that mean? It means it's not the Ministry of Health. It's not Jordan doing it. Jordan receives services from almost all of the programs I've got listed up here. Okay? It means that they're programs that don't have a government, but they go around the world. Okay? If you notice up here, Red Cross and Red Crescent issues. Okay? Red Cross or Red Crescent here in this part of the world is in Lebanon, it's in Jordan, it's in Turkey, it's in the United States as Red Cross, it's in Germany, it's everywhere around the world. They are non-governmental organizations that deal with health issues. Probably the other big one you've probably heard about is Doctors Without Borders, Médecins Sans Frontières. Obviously, when I say it that way, you can tell that their origin is French. But they go around the world, and they have doctors from everywhere around the world that go in the areas where there's a crisis to provide care and services. NGOs are critically important. We've got NGOs working with the refugee camps here in Jordan in all the different areas. When we talk about child care, Save the Children, Oxfam, UNICEF, going back to that one. Okay, so just so you know, there are different organizations that also help with healthcare issues. How do we assess global health? Well, we've already started doing that when we started talking about COVID. Okay, we started talking about morbidity and mortality rates. We're going to talk about life expectancy. Okay, that's how long, when you're born, what is the average age we expect you to live? We're going to compare that in different parts of the world. Jordan? I have two things to say about Jordan. In one slide, I'll tell you Jordan is one of the better places for life expectancy from the Middle East. And that's true. However, when we compare it on the world ranking, Jordan has a fairly low life expectancy. Okay? The average age of how long a man will live in Jordan is about 72 years old. That's not very long in comparison to other countries. Japan, the average life, which is the number one in the world, which you'll see later, has the number one longest life expectancy, and it's in the mid-80s. The thing I can tell you bad about the United States in life expectancy is up until this past year, the past 4 years before that, our life expectancy was actually going down, okay? Which means we're talking about different health issues. At this point, I didn't want to talk about dailies and quals, but I do want you to recognize the terms. We will come back to them. Dailies just means disability adjusted life years, and quals means quality adjusted life years, okay? In other words, we're measuring how long somebody lives a good quality of life, i.e. somebody has cancer. It's not just how long do they live with cancer, but how long could they live a normal life? That's quality or disability. One of you caught my typo. Thank you very much on the next one. The next line should say incidence and prevalence. Incidence, new cases. Prevalence, existing cases. And then, just like we were talking about with when I gave the Lancet article, is access to services. Can anybody receive the care? One of your classmates mentioned this morning, talking about having private hospitals provide services. This is at a reduced cost. That's exactly that type of component we're talking about here. Okay? So health policy. The actual definition is making decisions, plans, and actions to undertake or achieve specific health goals, care goals within a society. It's what we've been doing, okay? We've been talking about it from the application side. We can do it at the local level. We can do it at a regional level, which would be like Amman, Providence, or Urban, or Zarka. Or we can talk about a governmental, all of Jordan and the Ministry of Health. Or we can talk about global and WHO policies. Okay, and I just gave some examples of different types of policies here. So when we talk about a health policy, we're going to talk about setting priorities. Right now, and gosh, guys, we're going to have to get it changed so you all can talk back to me. I hate doing just talking to myself is what I feel like I'm doing right now. But what I want to say is if we talk right now, we need to set priorities. We need to set what we call parameters, the settings. What are the important? How much are we going to do of it? Two of the questions I asked you on the survey that I posted this morning are about you defining the priorities related to COVID. You defining what you think is. So I'm already asking you to think in these terms. Okay? Policies can be by a government, but they can also be by somebody else. But it's designed to solve the problem. So what does the government do? The government comes in and says, okay, we're going to have a lockdown. Or okay, we're going to do this. Or okay, we're going to do that. It is designed to solve a problem, to improve the quality of life. It's not designed to make you miserable. They didn't lock down on the weekends because they just said, oh, let's make everybody in Jordan unhappy. In France and Germany, other countries, in Europe this week, they are all going to, they shut down at 9 o'clock at night and they open up again at 6 in the morning. You've got more freedom during a regular day. I don't know why somebody needs to be out at 10 or 11 o'clock at night. Maybe we should have better, you could have a longer curfew in the nights when people don't really need to be out. The only thing you're out doing is socializing typically. So why do we need to do that when that's the risk? Let's shut down early, but let's have 7 days of shutting down early. Different governments have chosen different ways. Okay? The problem is before we have to find out, the government has to think it's important. And what we find is we do this policy and then it creates a new problem. So we have to keep adjusting and changing. Okay? We're going to talk about regulations. I do want to mention this very quickly. A lot of you have talked about let's mandate, let's make. A mandate is a requirement. Same way a speed limit is a requirement. They post that sign, that is the limit. If you're going over that limit, you will get a ticket if they catch you. That ticket is a regulation and an enforcement. Not all health policies need to have a regulation in them. I tell people when we talk about healthy nutrition and preventing cancer, we talk about eating 5 fruits and vegetables a day. Okay? With that example, I don't have the police coming to your house to say, did you eat 5 fruits and vegetables a day? The difference is I can't give you cancer. But ideally, we should be able to make health policies without having to make it a rule, a punishment, it should be common sense. If I explain, and I think with some of you, I know you've listened to me at other occasions, and like today, I think it's a punishment that they've told me to lock down my mic. I've locked it down, but I'm not having a dialogue with you. I'm not getting feedback. I'd rather have feedback, okay? So just so you know, policies. Typically, they're formal and they're written. If you remember at the very beginning of the COVID slides, I have a slide from the Ministry of Health, and it showed you the different guidelines they said. We have a curfew from this time to this time, from 1 a.m. to 6 p.m. We're at this level. Masks are requested. Those are policies. So they're showing you their simple little policies that they have right now. What does health policy come from? About every field you know. Okay? Again, like global health, it draws from economics, sociology, anthropology, public health, epidemiology. So I don't need to go through the list. Now, how does the World Health define health policy? Let me pause a second, because I am sure there will be 2 or 3 of you that after class today send me an email and go, what do I memorize? I am going to not answer questions that ask me, what do I memorize? Memorize is not learning. The other thing is right now, I don't want you to just memorize. If you notice, we have had 4 or 5 different definitions of health policy. I would encourage you to take all of those and put it together so you have an understanding of what is health policy. Okay, that's what I'm wanting. When we talk about from a global perspective, and remember, World Health Organization is talking about policy from a global perspective. It's about the future. How do we make more people healthy and live less sick? It says these are my priorities. Those are the SDGs that we're going to talk about. It defines the expected roles of different groups. In other words, governments need to communicate. We need banks. We need NGOs. We need other people to help with health policies. And it's a way that if we get everybody together, we share that information, and it helps and informs people. Okay? So they talk about it coming from that whole perspective. Now, these 4, absolutely, you need to know these. So what are the goals? Well, if we put all those definitions together, one is to keep people, first of all, it's a whole lot cheaper, and I know you just came out of Dr. Iman's Health Economics. It's a whole lot cheaper to have prevention than it is to treat people. In other words, it's much easier for me to ask you to exercise and eat a good diet than it is to treat you after you've had a heart attack with bypass surgery and rehab, and maybe you had a stroke and we have to do speech therapy or different components. Much cheaper. So the first goal is to, 1, prevent disease. How do we prevent disease? Think of it this way. We tell everybody about what you should and shouldn't do. That is health promotion. Okay? If we tell you what you should and shouldn't do, like right now, please wear a mask. Okay? You see me beating the table again. I had to go to campus yesterday while we didn't have office hours. There were 2 doctors in there that still refused to wear a mask. I don't want to be in the same room with them because they're going from every place around, having exposure, and then want me to talk to them. And they've gone from person to person to person to person. I don't know where all of those other people have been. Okay? I'm asking you, so my health promotion is I'm asking you to wear a mask. Okay? Why? To prevent COVID. So we've covered points 1 and 2. How do we do this? When you wear a mask, what do we say? Thank you so much for respecting my life. Thank you so much. Okay? We reinforce those behaviors. How does it reinforce the behavior? We start to see COVID numbers go down. We start to be able to go out at night. We are therefore reinforcing by wearing a mask, I can go do more things I want to do and need to do in life than being stuck and cloistered in my little house and not being allowed to go out. Okay? The 4th one doesn't quite tie to my link, but it's trying to modify biological processes related to diseases by early detection and treatment, and by improving access to quality care. actually, I can kind of tie this to it. Here we're talking about there's great concern if and when we get a COVID vaccine, who will be the first to get it? Should it be available only to rich countries that can afford to pay for it? Do we make it available to the world? Okay. Early detection. Shouldn't everybody, we could have class at school if we could create a way of quick detection that was cheap and affordable. In other words, you could walk up to the campus, they do a quick screening, 5 minutes later, you get a result that says, no COVID, you get to walk on in the room. And it's accurate to a percentage that we're not giving false negatives. Okay? If we had something like that, we could keep going. So there are people that are really, while some are working on a vaccine, some are working on how do we test, how do we make things that would be affordable, that would let us do things even more. So there are different ways of trying to address the concern of the COVID pandemic. Okay? So 4 policies of health policy, the 4 goals or outcomes, I've just kind of walked you through an example. I encourage you, come back and take these 4 things and see how you could do it with another disease, another condition. We do talk about, and I do want you, and as we go through the semester, we're going to look at things, goals, objectives, and targets. Several students the very first week of class sent me a message, Dr. Heather, how do I make an A in your class? Well, I can tell you their goal is they want to make an A. Just because I said I want to make an A is not going to get me there. You have to have objectives. A, first of all, let me say the goal of I want to make an A is a measurable objective. Notice it's not I want to do good. It's very specific. It has a number criteria. Okay? Good goals are measurable. We want to reduce the rate of infection by 10%. We want to increase compliance by 20%. If you noticed this morning on my post, when I talked about taking the survey, I said I would like at least 80% of the class to complete this survey by Friday. It's only 4 questions, but it's 4 questions that I want you to think, 2 a quick response, 2 make you think. So it was I have a goal, 80%. Then I'm happy. Okay? So a goal should be measurable. How we reach that goal are our objectives, okay? And before objectives, we have targets. So think of it like a step of stairs. The goal is the A. I can do this thing, and I can do this thing, and I can do this thing. Hopefully that will help me get an A. So right now, it's about reading the materials, reading the lectures before class. Those are the things that you should be doing right now. As we get closer to exam time and I've written an exam, then I will identify, oh, make sure this is important or that is important if I haven't said it already. We'll have a review session. You come to the review session because you go, I still have questions. So that's another specific objective you can do to help you do that. Let's say the first test you make a B on. Okay, it's not an A. You go back, you go, okay, these are the things I didn't understand. Now, what am I going to need to know in the future to go do better? What should I study? Oh, this is how Dr. Heather writes her questions. Now I know to change how I study this way. So we're always adding objectives, specific points that will help us get to our goal. Lastly, who is affected by health policies? If we look at this, all of us, individuals, examples, paying taxes on medications, having to pay for health insurance. That comes out of my pocket. I pay part of it, the government pays part of it. Communities. Where do we open a hospital? What type of hospital is it? Is it private or public? Those are things that affect a community. Countries. Do we have universal health care like Sweden and all of Europe? Or do we have a quasi system, which is kind of what Jordan has? It's trying to get to a universal. It's not quite there. Okay. Or do we have something like the United States, which says, no, we don't care. You have to pay for it. Either your employer has to pay for it, you have to pay for it out of pocket. You have to make enough money. And that was the whole thing about the Affordable Care Act. So having access to care. There are people here, we've talked about the price, that it's 35 JD if I want to go privately be tested for COVID. For some people, that is an astronomical price to pay. So unless they are actually sick, they're not going to go get tested. Okay? So we talk about access. And then we talk about, again, global. So here we start talking about our pandemics. We talk about contaminated water because water affects everybody. It all flows to the ocean. We're all impacted. Global warming, temperatures rise. Okay, they're polluting in China. As a result, we have different temperatures here now. I can say since I have lived in Jordan for the last 5 years, what have I seen? I've seen great temperature changes. And when I talk about climate change here, it's more about having more rain in the fall and winter. When I first got here, there were 2 or 3 days a year. Now we looked last winter, I think I was dumbfounded. 20, 30 days probably of rain at different times. So we see these changes. Other examples of health policies, things like vaccinations. Who can buy tobacco? What age do you have to be? In the United States, you have to be 18 to buy tobacco. You have to be 21 to buy alcohol. Another health policy, notice this one isn't written, but we talk about breastfeeding. And breastfeeding is the best thing for a baby, and it should be done for the first 6 months of their life. We can talk about a seatbelt policy, where you have tap water that is, you all don't have what we call potable, P-O-T-A-B-L-E, potable water. In other countries, you open the faucet, and you drink out of it. We put fluoride in the drinking water to help prevent cavities of teeth. This has been done in the United States since the 1950s. We talk about iodation of salt, and actually Jordan has 2 policies, and I'm going to show you something really quick in a minute that I want you to, if it will work. Okay, and the last is something like wearing a mask or social distancing. What I'd like you to do, so that has caught us through what was going to be covered very quickly. Okay, if you have questions about this, tomorrow I will be having virtual office hours. Now, let's go ahead and try to make this, for some of you, you've never had office hours, okay? You're used to just having faculty here and there everywhere. At school and high school, the faculty sit in their teaching classes all day. What I want you to know is it's not required, guys. Some of you come in and just sit and want to just sit there. It would be like coming to sit in my office while I do paperwork. I'm here to answer your questions, but if you don't have a question, no problem. It's not attendance. It's not required. It's a chance for you to come and ask me a question, and then you can go do what you want to do. You don't have to stay the whole time. You can just do that. So I want to encourage you. Once you pop on, I'll pop on, but then you can go and leave. Or some of you just want to have a discussion, and that's lovely too. Okay? So just so you know, it's not required. It's not something you need to be at, but some people want to have that extra time to ask questions. So that's what it's there for. I will be online, so tomorrow morning from 8 to 10, since we couldn't do it yesterday. The other thing is what I'd like you to do. You have a couple of things. You don't need to send them to me. Again, my goal is that at least 80% of you will answer the survey that I've put on the general team. Okay? So I'd like you to do that and have read, and look at these different articles. The next thing, our next lecture on Monday will be on demographics. It says demographics, and it's number 3. This week, there was an assignment in your Jordan health policy from the WHO. It was pages, I think, 3 through 18. I would like you to go through those pages and highlight and read through. What we are going to be talking about is demographics. What those pages have are the actual demographics in Jordan. Okay? So we can come back and forth and we can use those numbers. When we talk about this, I can say this is an example of this type of demographic. It has the demographics for the 2 words we talked about today, communicable diseases and non-communicable diseases in Jordan. Look at them. Look at the ones that are most important. You'll find out that some diseases Jordan has what we call eradicated, which means it no longer happens in Jordan. I'll give a bonus. I want to say bonus. I can't. They don't let me do that anymore. But I'll give kudos and praises. If we, I'd have a Snickers bar for you. For somebody that can tell me what is the disease that's been eradicated out of Jordan. Okay, in the 1990s. It was eradicated just before you all were born. So you've never had to deal with it, which is really nice. Okay, so these are things I encourage you to do. Those are your assignments. So prepare for class on Monday, which is reading the lecture notes on demographics, then looking at the Jordan demographics from the PDF file you have in your team folder, and completing the survey. Okay? Have a lovely long weekend. I haven't even looked this morning if we're still on policy for a full lockdown or a partial lockdown. So I need to go do my homework. Okay. Goodbye.